Does my baby have a tongue tie? A tongue tie is a remnant of tissue in the midline between the undersurface of the tongue and the floor of the mouth that restricts normal tongue movement. Tongue tie occurs in about 1 in 10 babies, and because the tongue movement is integral to infant feeding, it can affect both breastfeeding and bottle feeding. Most babies with ties can feed, but they adapt and compensate to varying degrees. Common difficulties are pain, shallow attachment, reduced milk transfer, tiring before getting full, and loss of vacuum that can be noisy. Even when a tongue tie is obvious, many mothers have their feeding concerns dismissed or not connected to the restricted tongue movement. This can be confusing and lead to unnecessary distress. It is reasonable to exclude a tongue tie as the cause of feeding problems, but it requires skilled evaluation and timely resolution of feeding difficulties. Talking about tongue tie being a fad, blaming nipple shape, and giving products to manage symptoms indefinitely are not adequate responses in the presence of breastfeeding difficulty. A skilled evaluation includes a thorough oral examination, observing a breastfeed until the end, taking a history, and evaluating what a mother has tried already. Many breastfeeding difficulties are resolved by adjusting the attachment and using accurate information about how breastfeeding works. When this does not resolve the problem, it is more likely to be the restricted tongue movement from the tongue tie, and a release can be recommended. If this has been your experience and you continue to have feeding problems, maybe you need a second opinion. We will do a skilled evaluation, offer suggestions to improve the feeding, and discuss release if it is indicated. The parent should always make an informed decision about treatment. At Premier Lactation, our aim is to improve feeding difficulties with practical suggestions and minimal intervention. If release is indicated, we expect the best functional outcome with the least amount of trauma to the child, and we want you to leave empowered to be in control of your breastfeeding relationship. With a functional release of the tongue tie, identified feeding problems should be resolved immediately. And of course, there will be the rare exception with other contributing factors. Breastfeeding is the best exercise, other exercises should not be necessary. A tongue tie release should not involve other oral tissue, e.g. lip and cheek, unless a clear explanation of how they are affecting feeding is given, and this is demonstrated post-release. There is a lot of discussion on social media about tongue tie, but what does the evidence say about treatment? The overall goal is to perform the surgery in a minimally invasive way, effectively dividing the sublingual frenulum to release the restriction of the tongue and restore an adequate range of movement, allowing for effective and comfortable breastfeeding. The use of scissors for treating a classic tongue tie in breastfeeding infants has a long clinical history and remains the gold standard. The Academy of Breastfeeding Medicine goes on to say, in addition, scalpels, electrocautery and lasers are currently used to perform frenotomies. To date, there are no published studies comparing these surgical instruments or the methods used when performing frenotomies. We hope this video will help you get the help you need from your health professionals, or you can book an appointment with Premier Lactation on our website. Thank you for watching.